So I'm Dr. Ruth Weldon, one of the specialty doctors in the emergency department. In 2018, we introduced frailty practitioners to the emergency department as part of the CEO transformation project. We needed to prioritise the care given to older patients as they attend A&E. They tend to be quite complicated, often have cognitive impairments. It can take quite a long time to get all the information. And we found that a lot of these patients were getting admitted because we were running out of time to assess them properly. We introduced 4 frailty practitioners to the department, running a service 8 till 8, 7 days a week. And actually the effect that it's had on the department has been quite dramatic.
We work alongside the medical team to assess patients when they come through the front door off the back of the ambulances. We do a bit of information gathering, mobility and transfer assessment, liaise with next of kin to try and establish how the patient normally manages at home and whether or not we can get them home safely if they've not come in with a medical problem.
This really helps the doctors so that by the time we are at 2.5 hours having to make a decision as to what happens to that patient, we are much better informed and more likely to be able to avoid admission and send those patients to an alternative pathway, if not home. The ED department have really welcomed the frailty team and they're very much part of ED. We really couldn't manage the ED and the frail patients without them.
I'm Brenda, I'm the matron for the emergency department, and as part of the project our aim was to reduce our admissions by 2. Throughout the course of the project we were seeing between 2 and 10 patients a day, and we actually exceeded 60% of those patients going home, so it was deemed very much a success.
Since we've started the frailty friendly front door, there has been national guidance produced that by December 2019 every type 1 trust must have same day frailty services. So by delivering this project now we are already ahead of national guidance.
Hi, I'm Helen Challand and I am the matron for general surgery and gastroenterology, and in 2017 we applied for transformation funding from the CEO to improve the facilities that we have in the surgical assessment unit. We were successful in obtaining £32,000 that we used for building work to convert an area on Lister Ward that was a inpatient stay area into the assessment unit, which now consists of 6 chairs and 6 trolleys to assess patients. It's a very light and airy space, and it's really improved patient experience and staff experience from what we had before, which was literally a 5-bedded bay with relatives and patients having to wait in the corridor if we were busy.
The difference it's made to staff has been absolutely huge. It has given the staff better job satisfaction, it's increased everybody's skills. We run a very nurse-led unit now. We're able to utilise lots of different resources to be able to take more patients. And in terms of patient care, we have everything localised now within one area, so patients get to see the right people at the right time and get the right care.
Patients are able to come straight from the emergency department to this dedicated area which is attached to the surgical wards on the same level as both intensive care and theatres, and it means that we can follow the patient's journey through their whole pathway from admission through to discharge. And it's also an area we can bring patients back if they're not necessarily needing to stay in hospital, so can come back to be checked over by us and have simple tests.
As a patient, from my experience, it bypasses the stress and anxiety of potentially going to alternative medical routes first, whether it be A&E, West Call or a drop-in surgery. You get to the right people at the right time. Also consistency of care if you've recently been discharged, and it just all removes time, hassle, stress, anxiety for us, patients, and for efficiency it frees up A&E and other staff to do what they want to do while you're seeing the right people.